So sometimes you may be working with a refugee guest who needs access to health care. Maybe they have some issues that they weren't able to take care of overseas, or maybe they're just switching doctors from the doctor that they had when they were in their home country. And you might not be sure how to do that because refugee claimants are not eligible for OHIP, but they are eligible for a federal program called the Interim Federal Health Program that's administered through the Blue Cross. So under the IFH program, doctor's care is covered and hospital stays are, and all refugees have to do is to show their refugee ID, which is what we sometimes call their brown paper. It has a little picture of them in the corner and their UCI number. But not everything is covered. In fact, it's a little bit complicated navigating the list of things that are covered and aren't once you get into things like braces for legs or additional supports for different conditions. So the best thing to do is to call the Blue Cross if you're not sure what's covered. If the refugee guest needs your support with that, it may be that their healthcare provider is already taking care of that, but just so you know, you can call the Blue Cross to learn what's covered. So it's very similar to OHIP. It covers most of the same things, but there are some additional coverages to take into account the fact that some people have maybe been on the run for many years and haven't been able to take care of things like their teeth or their vision. So there are a couple limited things that are available to them. And these additional things are covered in a limited way because we know, and we've seen in the past, that when people do not receive primary health care, when they don't get some of these things covered, they end up accessing emergency rooms for health care. And that's bad news for everybody, for the refugee claimant, for our medical system, etc. So prescriptions are covered, but not all pharmacies know how to bill Blue Cross through the refugee ID. So we've had some success in the past with Shoppers Drug Mart, but you still might have to explain to the pharmacist or the guest, if they're able to with the language barrier, you might have to explain to the pharmacist how to bill the Interim Federal Health Program with the refugee ID. Physiotherapy is also covered, but again, not all offices will know how to bill the Blue Cross for serving a refugee claimant. So it's good to check before a refugee claimant receives service that that office knows how to bill the Blue Cross and is willing to do so. Other things that are covered under the Interim Federal Health Program include limited vision and urgent dental care, home care and long-term care, and things like mobility aids, hearing aids, and diabetic supplies. Again, if a guest is trying to access health coverage and you and the guest are not sure what's covered, the best thing to do is to call the Blue Cross. You can just Google them and find their number. Another key resource in navigating all this is Refuge Newcomer Health, which is located downtown. They specialize in providing healthcare services to newcomers, and they're just really excellent at removing barriers that refugee claimants face in accessing healthcare. They often offer interpretation, but if they don't, we may be able to coordinate an interpreter so that a refugee claimant can really understand what's being said and communicate effectively about their needs and their preferences. Refuge has many on-site services for different specializations like dermatology, mental health counseling, psychiatrics, and pediatrics. And if they don't have a service in-house, they'll often refer a patient to other services in the community. So when in doubt, call Refuge. If a guest mentions that they have mental health needs, or perhaps you notice some symptoms of mental health challenges, you can connect with your kinship circle leader, and they have a list of counselors who may be able to help. On our list are people who offer services in languages other than English, who specialize in working with refugee claimants or people who have experienced a lot of trauma, or people who even offer free or discounted services to people of color. Remember, as with anything, you never have to figure this out on your own. If you notice something or you're running into a challenge, you can always connect with your kinship circle leader, and together as a kinship circle, you'll figure it out.